I'm delighted to introduce Bernie Siegel, tremendous collaborator, advocate for patients, and we appreciate all of his leadership in this area. He's the executive director of Regenerative Medicine Foundation and also leads the World Stem Cell Summit. So I'll turn it over to Bernie.
Okay. Hi, everyone. 22 years ago, when I was a young guy at 48, I had colon cancer. And as many of us have in this room have suffered from an affliction or have a loved one, I had a tough year. But after that year, I decided to dedicate myself to a broader purpose. And 16 years ago, I founded a nonprofit organization which became the Regenerative Medicine Foundation to accelerate regenerative medicine, to improve health and deliver cures. And of course, definitions and wording is confusing. We do the World Stem Cell Summit. We do regenerative medicine. We do advanced therapies. But all of these technologies, it's the fourth pillar of medicine, something that has accelerated tremendously with the convergence of technologies that we have today: microscopy, machine learning, AI, nanotechnology, et cetera, the information age. So a medical and scientific revolution that would have taken centuries and decades is upon us right now. And of course, that leads to a lot of issues. And one of the things in creating World Stem Cell Summit, I interviewed every year for 16 years, 200 potential speakers. And I got to understand the network. And there's a slide that's in your possession, you might be seeing in a second, which is called an ecosystem slide. And it has workforce development in the center of all these nodes. But it isn't just workforce development. Any of you in this room represent could be I am here in the middle of a vast enterprise and ecosystem. So what I'm going to tell you in this short time that I have is be very direct. Let me be very direct. I want to talk to you briefly about the bad actors, because I know that's why a number of you came into this room, and Dr. Scott Gottlieb, former director of the FDA, sort of coined that term. And in my view, as a patient advocate, I want this field to accelerate. But bad actors, we know it when we see it. I've read the complaints. My background is law. I've read the pleadings and the cases, sometimes before the settlements that might have non-disclosures involved with it. We're talking about egregious medical malpractice, flaunting of clear regulations, deceptive trade practices. Not every practitioner is a bad actor, but those that are scourges to the patient community. They are not creating hope, they are crushing hope and ruining it. And that's why we applaud the FDA for its service. We applaud the FDA and feel that the FDA needs our support to move this on. But they're not only bad actors, right? They're questionable actors. They're questionable actors that are trying to improve themselves. There might be good actors, medical institutions tied to academic centers that are working on this, and just plain actors. So how is the FDA going to do things without resources? So quickly, I want to tell you that right before my birthday last week, I live in Wellington, Florida, in Palm Beach County, and my wife and I received this in the mail, as many of our neighbors. It's an invitation. Learn how to harness the power of your stem cells for your knee, hip, shoulder pain. Regenerate before you operate. And here's the key: free lunch seminar. Well, you can imagine the restaurant was packed. I enjoyed my salmon. However, I learned that this medical professional that gave a wonderful lecture showed testimonials from some of his patients that all loved him. He was a nice young man. But he's getting bags of cells shipped from something that he called FDA-certified umbilical cord tissue. Was it contaminated? Did he have the skill sets or the training to administer these cells? Did he know whether he was going to be providing an infectious condition on any of this? Yet, this is sold as an elixir. And for $3,500, you too can have a chance to do that. And very quickly, but wait, there's more, as they say in the infomercial. We get the Palm Beach Post there, because some of us still read newspapers, and you get these wraparound ads. And I hope no one in the room is from this particular clinic, but I want to show you wrapped around the Post and it opens up, and you see what they call in the real estate community active adults, people over 55, and at the back page, they're jumping around. Look at this. This is what this clinic will do for you. For these, did they follow the guidelines? Did they look at the guidelines? I submit to you, when you go to the seminar, you're going to be disappointed. And finally, we get an ad from in this case, an orthopedist, a well-regarded orthopedist, by the way, and I'm not impugning anyone's integrity, but in his ad, that he's providing services as well, he's telling us you need to think twice before you use placenta and umbilical cord cells, because there are no live cells. You see, he's doing something else. So what I'm telling you is there is an erosion of public trust, and this hinders the field enormously, because we're in a position now where we want to see clinical trials advance. Look at Dr. Kurtzberg. Her labs have, and her clinical trial is going along with philanthropy. What do we need? We need federal funding support for clinical trials that are going on in academic centers so we can advance this field. There's not enough philanthropy, and industry can't supply this. This is a brand new field of medicine. This is what we have to do. We have to develop projects like workforce development, and I want to make sure that you look in your book on page 12, because there's a wonderful discussion on workforce development. It's right in the middle of the ecosystem, because none of you know you're in an ecosystem until you pull this out. And for me to understand the work I was doing, I had to create this infographic, and I'm not an infographic person generally. But the workforce development in NSF is a powerful movement. I want you to think about all the community colleges and almost every congressional district, right? And they have a biotechnology technical course and a certificate that they might be able to get and training. But this is the fourth pillar of medicine. And if you're going to have training for pipetting, for the skill sets needed for cell and tissue-based products, those courses are not being given yet. The curriculum has not been solidified. Every meeting that I go to around the world, and you ask a company, go to an exhibitor or a trade show or any company you deal with, how are you getting your trainees? Do they have the computational skills that they need? Do they have the technical skills? There is an enormous shortage, and there is a huge unmet need. And if the United States is going to be competitive with the rest of the world gets it, and they're pouring resources into this. We must move forward to advance this field. And finally, I want to mention, because we only have a short period of time, an outcomes database. This is very, very important. We hear about real-world evidence. With a registry, with an outcomes database, the shareable data can so advance the field. It is a priority for the field, and we believe a federal-funded outcomes database for regenerative cell therapies would be very, very strong to advance the field. Thank you.